Thanks for the opportunity that has given to me. First, let me introduce myself. My name is Intania Mowilos. I'm from class A4 nursing, and in this video, I will tell you about GERD. Gastroesophageal reflux disease is a chronic condition in which stomach contents rise up into the esophagus, resulting in symptoms and/or complications. Symptoms include the taste of acid in the back of the mouth, heartburn, bad breath, chest pain, regurgitation, breathing problems, and wearing away of the teeth. Complications include esophagitis, esophageal stricture, and Barrett's esophagus. The most common symptoms of GERD in adults are an acidic taste of the mouth, regurgitation, and heartburn. Less common symptoms include pain with swallowing or sore throat, increased salivation, also known as water breath, nausea, chest pain, and coughing. GERD sometimes causes injury to the esophagus. These injuries may include one or more of the following. First, reflux esophagitis. Reflux esophagitis is inflammation of esophageal epithelium which can cause ulcers near the junction of the stomach and esophagus. Next, esophageal strictures. Esophageal strictures is the persistent narrowing of the esophagus caused by reflux-induced inflammation. Last, Barrett's esophagus. Barrett's esophagus is intestinal metaplasia, changes of the epithelial cells from squamous to intestinal columnar epithelium of the distal esophagus. GERD may be difficult to detect in children since they can't describe what they are feeling and indicators must be observed. Symptoms may vary from typical adult symptoms. GERD in children may cause repeat vomiting, effortless spitting up, coughing, and other respiratory problems such as wheezing. Inconsolable crying, refusing food, crying for food, and then pulling off the bottle or breast only to cry for it again, failure to gain adequate weight, bad breath, and burping are also common. Children may have one symptom or many. No single symptom is universal in all children with GERD. The treatments for GERD may include food choices, lifestyle changes, medications, and possibly surgery. Initial treatment is frequently with proton pump inhibitor such as omeprazole. In some cases, a person with GERD symptoms can manage them by taking over-the-counter drugs. This is often safer, less expensive than taking prescription drugs. Some guidelines recommend trying to treat symptoms before using a proton pump inhibitor because of cost and safety concerns. Certain foods may promote GERD, but most dietary interventions have little effect. Some evidence suggests that reduced sugar intake and increased fiber take can help. Avoidance of specific foods and hot eating before lying down are recommended for those having GERD symptoms. Foods that may precipitate GERD include coffee, alcohol, chocolate, fatty foods, acidic foods, and spicy foods. Weight loss may be effective in reducing the severity and frequency of symptoms. Elevating the head of the entire bed with cloths or using a wedge pillow that elevates the individual's shoulders and head may inhibit GERD when lying down. Although Moderate exercise may improve symptoms in people with GERD. Vigorous exercise may worsen them. Breathing exercise may relieve GERD symptoms. Abstinence from smoking or alcohol does not appear to significantly relieve symptoms. The standard surgical treatment for severe GERD is the Nissen fundoplication. In this procedure, the upper part of the stomach is wrapped around the lower esophageal sphincter to strengthen the sphincter and prevent acid reflux and to repair a hiatal hernia. It's recommended only for those who don't improve with PPIs. Quality of life is improved in the short term compared to medical therapy, but there is uncertainty in the benefits over surgery versus long-term medical management with proton pump inhibitors. When comparing different fundoplication techniques, particle posterior fundoplication surgery is more effective than particle anterior fundoplication surgery, and particle fundoplication has better outcomes than total fundoplication. Esophagogastric dissociation is an alternative procedure that is sometimes used to treat neurologically impaired children with GERD. Preliminary studies have shown it may have a lower failure rate and a lower incidence of recurrent reflux.